for everyone. Bumrungrad International. A round of applause for our trailer. It's really easy to understand. Greetings once again from our Facebook Live online. For our press conference on the theme, Unlock the Future of Screening and Diagnosis with Photon Counting CT Technology. This is an official press conference. I, Tasanu Dirpanya, Division Director, Medical Support Services at Bumrungrad International. I would like to invite Barry Wolfman, Senior Executive Director of Operations of Bumrungrad International. Please come on stage to deliver his opening speech.
Wolfman, Senior Executive Director of Operations of Bumrungrad International Hospital, to the stage to deliver the opening speech. Please, Mr. Wolfman.
Good afternoon. I am very proud and I'm very humbled to be here among so many of my colleagues, my executive team, our staff, some of our referral office colleagues, Siemens colleagues, and the press. It's an honor to be here. So thank you for joining us. It means a lot. And I'd like to thank Chris Perret from Siemens for helping to support this event and for your partnership in advancing medical technology at Bumrungrad. So thank you. We're pleased to introduce Photon CT. It's an advancement in diagnostic imaging and medical imaging, and it's the first of its kind in Thailand. And actually, there are only 180 of these units in the world. So think about that. We are on the forefront and the cutting edge of technology, and we are honored and proud to do that. So we build on our strong foundation of existing technology. We build on our existing foundation of commitment to patients, commitment to our medical staff, and to everything that we do about advanced medicine. So this unit, it enhances image quality, it reduces radiation exposure, and it refines how we diagnose and treat many of the medical conditions of people that come to us looking for answers. We are always and continuously looking for ways to elevate patient care. We want to make sure that our physicians and our staff have the best technology to support their expertise, and we rely very heavily on their expertise. So this technology provides even greater detail and precision, which allows for more informed diagnosis to be made and decisions to be made that contribute to the well-being and the better treatment of our patients. So Photon Counting CT is our commitment to integrating AI and advanced diagnostics, adopting innovations that enhance our ability to take care of patients. From AI-powered lab automation to next-gen imaging, our focus remains on using the right technologies to improve patient care in the right and meaningful way. So I'd like to again extend my appreciation to all our physicians, to our colleagues, to my executive team for the commitment that we make to truly advance patient care. And to Siemens, again, thank you for your support in bringing together this incredible day for us. The unit is in use already, and we are already making diagnosis and treatment plans. And so I'm really excited about this. I don't get excited about a lot of things, but I'm excited about this. So we will continue to move forward. We will continue to innovate, and we will continue to serve the world in the best possible way that we can. And we do such a great job that we will continue to do that. So again, thank you for being here, and thank you for all your contributions. Thank you.
Thank you, Mr. Wolfman. Wow, what a touching speech. อย่างที่คุณแบรี่ได้กล่าวไปข้าง
Barry has mentioned in the start, it has been 4 decades non-stop in the development of application of the latest technology in application to enhance the confidence for our patients and those that use our services universally. Lately, Bumrungrad International is the first hospital in Thailand that has used Photon Counting CT with diagnosis in medicine, so our physicians can have proper precision diagnosis and have proper treatment precisely. And of course, preventive medicine for better health care in the long term. Bumrungrad International have partnered, a very important partner, such as Siemens Healthineers in the bringing on this latest technology in our hospital to push the envelope when it comes to medical innovation for excellence in healthcare. On this occasion, I would like to invite Chris Poray, Managing Director of Siemens Healthineers Thailand. Please come on stage for your speech.
Mr. Chris Poray, Managing Director of Siemens Healthineers Thailand, to the stage to deliver his speech. Please.
Wow, what a day. Today, Photon counting is here in Thailand. I've been here in Southeast Asia for around 6 or 7 years now. And from all my interactions with customers in the region, Bumrungrad continues to come up in conversations. Bumrungrad is the benchmark that many hospital healthcare providers aspire to in the region, but also globally. So congratulations for that. Congratulations for setting that benchmark, and it is truly an honor to be a partner with Bumrungrad. So this is really a milestone because this is the first photon counting CT system in Thailand. And I think for me, partnership is all about a shared vision and shared values, right? And here we are sharing the same vision about advancing patient care through advanced technology. At Siemens Healthineers, our broader vision is about pioneering breakthroughs for everyone, everywhere, and doing it sustainably. And as a medical technology company, innovation is really at the heart of everything we do. It's really at the core of our company. And so we believe that through advancing technology, we can really bring a better experience and better patient outcome. With regard to photon counting CT now, we have scanned over 1 million patients globally. We are in 30 countries, and there are around 500 academic papers around the benefits of photon counting CT. And also, we've demonstrated that we can really improve the speed of scanning, and at least one healthcare institution has demonstrated they can scan up to 110 patients in one day. But photon counting really requires a big investment, and this has been a journey for us for around 20 years. So actually research into the detector technology, which the photon counting CT is based on, started in around 2003. We saw our first prototype in around 2014, and we launched this system in 2021. So it's a big investment in research and development, and we need to continue to make that investment. We need to, at the moment, we're actually scaling the production of this technology. We're building new production facilities in Germany. And at RSNA last year, we actually launched 2 new systems in order to be able to address the more affordable segment for this market. So with that, you know, today I feel is really a great milestone. It's really a pleasure to be working with Bumrungrad that's really driving this innovation into the Thai market. And yeah, I think together we're really paving the way of innovation and healthcare and patient outcomes in Thailand. So with that, I'd like to thank Bumrungrad once again. Thanks for the great event. And yeah, look forward to our continued work together. Thank you.
Thank you, Mr. Poray. What a remarkable and inspiring speech indeed. Thank you. เรียกได้ว่า Siemens Healthineers
Consider that Siemens Healthineers is the leader when it comes to medical innovation in being creative with new technologies that play a significant role in pushing the envelope of the integration of medicine safer. And this is why Bumrungrad International is the first in Thailand that has brought CT machine here. I do believe that photon counting CT will be beneficial for our patients, both in the quality and safety, which is considered is the heart of Bumrungrad in the process of diagnosis and treatment of our patients. And as of today, we are honored for our 5 medical specialists that will share their experience in the treatment and share their first-hand experience and the benefits of this technology. On this occasion, I would like to invite where are Whit, the radiologist, body imaging, Dr. Cho, neurologist, head of neurological research, Associate Professor Shok Rim Suwat, pulmonary disease specialist, Dr. cardiologist, and Associate Professor Dr. Kirikun, Chief Science Officer, cardiologist and geneticist. And one Dr. Benjamin, Head of Imaging, as the moderator of today. Please come on stage. Thank you very much, Dr. Tassawood, for the introduction. Without further ado, I would like to begin our panel discussion with Dr. Witt. Professor, CT photon counting, what is CT and how is it different from the conventional CT machines? Thank you. Well, CT photon counting is an innovation that have made leaps when it comes to CT technology and X-ray, because when we come to imaging, computer imaging with CT at present conventionally, we have to translate photons into rays, and then we'll have this transmitter to change this electric and translate into imaging. But photon counting CT, this machine has a semiconductor which can detect photons directly. This is the reason why only one step. When we have the photons, the image and the data will be more precise, high resolution. Furthermore, besides detection of photons, we can measure radiation of the photons and the energy level. Energy measuring will give us data for the radiologist in diagnosis for the different types of tissues and abnormalities in the body. The higher resolution, the enabling to see the abnormalities of the organs, the small minute detail. What we often use in general, we use for the blood vessels in the heart because they're small, capillaries, right? So when they're in blockage or in plaques, for instance, or a blockage, the conventional CT scan cannot actually cover it, but CT photon counting can have higher resolution imaging. So when we say that there is a blockage, we can have proper treatment in the future. Precisely too. Photon counting can also detect abnormalities in the body, such as pulmonary disease that are minute, or even kind of tumors that are inside the internal organs, such as the pancreas or the liver. Photon counting can see it with clear imaging. So other small organs that would be beneficial, such as you can see the valves or the inner ears, for instance, or the cartilages, which are so small in the ears, right? The photos are very high in quality images, or even the wrist angle, the wrist joint, right? Many multiple bones, right? The CT photon can actually see through, and most beneficial is fast. Yes, Professor. As the preliminary details that you have informed, we can summarize that when it comes to CT photon counting, the major benefit is that in detail, high resolution, and also speed in scanning. Right, Professor? Professor, one more question. I would like to know the benefits that will befall to the patients from using CT counting or using this particular machine. What are the benefits for the patient? Well, the major benefits of photon counting CT versus the conventional CT, there's actually two major things. First, the amount of radiation that is dosed to the patient as lessened by 30 to 40% less. As we all know, when it comes to CT uses a lot of radiation, right, for treatment, right? But the radiation is actually not good for the body. Will have the side effects to it. The more you are exposed to it, may cause cancer. Photon counting technology, the other benefit, that higher resolution, less radiation. This is the reason why it is truly beneficial when it comes to diagnosis to the patient, which is, for instance, children, for instance, when it comes to that kind of children cartilages, right? It will be safer for children. Another group of patients are that you have to repeated CT scans for chronic disease, for instance, or cancer patients that have too many rounds of treatment. The exposure risk of the radiation will be lessened. Furthermore, we can also apply this and in screening different types of diseases, such as looking for abnormalities in the heart vessels, for instance, blockages or plaques, or even screening pulmonary cancer. Another benefit that the patients will receive, because higher resolution, that when it comes to the kind of substance that we need to blend with radiation, we can actually inject at a lower rate, almost to 20 to 30% less. When it called, this is called radiation chemicals, is that will be beneficial to patients that have issues of the efficiency of the decrease of the liver, because these kind of chemicals may have an impact on the liver. If we can decrease chemicals and radiation, will be beneficial to the patient. Well, in summary, CT photon counting will assist in diagnosis precisely, precision, safety for the patient, and the treatment highly effective. Is that correct? Yes. Thank you. I would like to ask Professor Workshire, CT photon counting, so many benefits when it comes to the group of patients that has neurological diseases, for instance. Professor, what do you see does it benefit, and how does it support when it comes to medical personnel, when it comes to neurology? Well, in truth, my focus in patients that when it comes to the blood vessels in the brain. In truth, these kind of cases, we have seen in prevalence is that there are two things that we've seen in prevalence, is that what benefit is the amount of, when it comes to the chemicals, radiation chemicals, that is less. Lately, there was a patient flew from the Middle East, arrived in evening in Friday, and he wants to be scanned in the morning Saturday. Instead, if it used to be conventional machines, we probably use CT, and then we'll wait about 2 or 3 days. It will actually, the patient will waste in cost in hotels and accommodations. By using photon CT, we get only 40 CT of radiation chemicals, and then we can actually reach the blood vessels immediately. At least the patients will not waste the efficiency of their liver and their time. The patients can be discharged back home. Second benefit, what the physician benefits is that you can actually plan the treatment. We had a patient this patient is 103 years old, right? That they had to diagnose a blood vessel in the left side of the body, and we see the MR. The MR was unclear. This is the reason why we couldn't see from the imaging, was unclear. So I decided that if we decided to an alternative route in the surgery, it's going to be a challenge. So that day I made a call that we're going to begin with the vessels to the left, which it came from surgery from the left side. If we had CT photon back then, we do not want to have that kind of invasive surgery or 2 holes in the body. So I think extremely beneficial. And finally, the patient that after the radiation chemicals, sometimes they feel a tremendous headache, or after we have to loosen a balloon to expand the vessel, we have no idea if there is any hemorrhaging inside the head or not. So I do believe that CT photon can actually help us distinguish. Lately, we were able to sleep well at night, right? We still feel the safety and the benefit of the patient, right? The patient told me that he can sleep well because as a clinician, we are satisfied and help truly assist the physician. Thank you very much, Professor. As Professor Workshire has explained, besides the benefits of the diagnosis precisely, you can actually use CT photon counting for planned treatment to decrease the time for the patient in recuperation at the hospital and increase safety for the patient, right? Now, next I would like to ask Professor Shok. As you can see, at present, when it comes to pollution in the air, it has increased day by day. when CT photon counting, how will this technology play a role for you as a clinician or seek and unveil the preliminary stages of pulmonary disease? As you know, everyone is concerned about lung cancer. All the news in the media, younger people suddenly have lung cancer. Lately, we have found a patient that had no personal disease, a woman, age 30. She has stage 1 lung cancer that we actually discarded. Maybe had the referred from other hospitals, but then we treated her at Bumrungrad. But the issue here is that how can we apply this technology in application with the clinician? And how can it create the ultimate benefit for the patient? Absolutely, we know that at present, lung cancer is the top reasons for patients to die from, lose their lives from the disease of cancer, right? Those guidelines, smokers, cigarette smokers that smoke more than 1 pack a day, at the age of 50, 80, this is one of the early indicators. This is the kind of practice that we did in the United States. And back here in Thailand, we use the same prognosis. But the thing that we do not know is PM 2.5 and air pollution, when to screen and how to early diagnose, because as of now there is no academic research or paper. But from my experience, for families that have a risk of pulmonary cancer or types of family diseases, that genetics may actually play a role, but I will recommend to screen. Absolutely, when you screen, we want the proper tools, proper instruments that the patients will have the ultimate benefit, which is high resolution imaging. CT scanning, that we are able to see the patients from older images because they can't screen, because some of the time the gap, but dual energy CT scan, and now photon, the imaging, the higher resolution at the edges, it enables the clinician to decide how does that kind of scan look like cancer. So if you compared, it's not only about the imaging, it's about mapping for the physician. I do procedures too. When we have a sample from the lungs, it can actually assist us in having the right decision for treatment. This is the reason why I personally think this is appropriate technology for lung cancer screening. For one, it's fast. Second, we call it low dose radiation. Combined with photon, the dose even gets lower. This is why patients that need screening annually, they will get the benefit of higher image resolution, lesser radiation, and when it comes to safety, increases safety as well too. This is the reason why it's a technology that is extremely beneficial that we applied here at Bumrungrad International. Thank you very much, Professor. As you can see, we may not necessary to be worried about the screening for the group of patients that use CT any longer, because CT photon counting answers the challenge of decreasing of radiation that be dosed on exposure to the patient. One more thing I wanted to add. Just a moment ago that I'm not an expert, so I asked a radiologist. But photon, if you combine with low dose CT, it's like X-ray for like 3 pages, right? Or three slides that uses very low radiation. Yes, and we have a pulmonary specialist here to increase the confidence of patients and our listeners. So when it comes to CT photon counting, not only benefits for neural disease or pulmonary disease, but one more disease that is quite prevalent is about cardiovascular disease. Professor, CT photon counting, as you can see, how does it assist with your confidence in proper planned treatment, or how does it assist you how to screen and filter patients that had no prior diseases when it comes to cardiovascular disease? Well, CT photon, what we call CT coronary vessel disease, is one of the tests that we use for diagnosis for cardiac vessels. They don't have to insert a tube inside the heart, which means CT in the past conventionally, CT photon counting will increase the resolution of the imaging. This enables us to see the lipid strains or even plaques, for instance, or calcium buildup, or even the early stages of the disease, or the prevalence or the level of the disease, or how much the vessel has been blocked, and we can have the proper treatment for specific treatment for each patient. I want to say that CT photon counting is actually fills in the gap of the CT coronary in the conventional wise. This means it decreases the artifacts or the blurring of the plaques, which is the conventional CT. We know that when a patient has a plaque or that kind of things, it's kind of hard to read the results because, as you can see, there is plaque, there is the cord. Right, the cord is kind of blurring in the image, especially in that kind of blood vessel. You can't actually tell with confidence how much has the vessel been blocked or not. In the end, they can actually need to get a chemical radiation injection later on. But CT photon counting, using this artifacts, this kind of blurring, we eradicate that completely. The imaging with high resolution, with precision, is that this is a plaque, and this is at the edge, this is not a plaque. And the cord is going to be very small when it comes to CT counting, enabling us, the physician, with confidence that if this vessel is blocked or not. It will decrease the patients to undergo all this kind of invasive treatment, especially the heart, which is not necessary. It actually decrease the exposure of the abnormalities of sepsis later on. Thank you very much. For CT photon counting, actually, as an analogy, is an instrument that increases safety to the patients, right, Professor? And now, when it comes about long-term treatment with patients with heart disease, how can this technology benefit the physician? Well, I have to tell you, CT photon counting should play a role since from preventive stage or the early stages, patients that have a risk or unambiguous symptoms. This will be less opportunities to have issues with vessel disease. We won't recommend it to use with heart vessels. CT can evaluate if there is a block or not a block in the heart vessels. The patients can see the imaging to create the awareness to the patients that what level is the patient at risk at. If, there is a plaque buildup, yes, there are symptoms of heart disease or even lipid stains, the patient will increase personal care, decrease of medication. That is the preliminary stage. But when it comes to the follow-up, as a patient with the disease, there is opportunity to have recurring of the disease, once again, if they don't treat themselves well. For those that have insert a cord, they may have uncertainty. Like in the past, we would have to bring them back to the hospital to inject the chemical radiation. But with CT photons, we can bring the patients that already have a cord inserted in the heart, but they're quite uncertain. Why don't they have to have a CT photon screen? We can screen the patients between that we need to have a resurgery, or we can use adjust with medication or change of lifestyle to have a proper treatment, case by case. Now let's hear from another cardiologist. This is a specialist. He's a cardiologist and of course a geneticist as well too. Ajahn Polisit, when it comes to preventive medicine and genetics, what do you say when it comes to CT counting? How does CT counting play a part, or how can assist the physician? We don't want to call patients, let's call it as a population, because the customers are at the population wise. Professor, when it comes to population at risk with higher healthcare and prevent themselves for the diseases, what would you recommend? First off, I would like to say, when it comes to healthcare, preventive healthcare is linear. You have to work with each physician, the radiologist, or even pulmonary specialist, neurologist, or cardiologist. In reality, when it comes to the principle of preventive medicine, we try to seek what? Seek for risk. Risk is the culprit here. We want to find the culprit. How severe is the culprit? Bad or not bad, right? So if severe, if it's a culprit, you need to eradicate. Photon counting, for instance, will truly benefit and assist. I'll tell you how it assists us. The doctor can see that the culprit, the level. If you want to inspect the lungs, if there is a spot in the lungs with the latest state-of-the-art technology, you can assist the physician that, hey, there is opportunity that it can metastasize into something as a bad culprit. So with photon counting, this kind of extra lower dose, higher resolution, lower risk, we can actually tell that the patient, well, let's go follow up on this culprit. Same thing with the heart. All this kind of lipid, all this fat that may cause the blood blockage. There are culprits, right? So when it comes to genetics can actually aid in preventive medicine. We will tell about risk equals culprit. This is the reason why our hospital is that we try to seek new technology. We look at genetics, for instance. Let's talk about heart disease that you probably heard before. Some of you may not have heard before when it comes to high lipid or high cholesterol in blood, for instance, or in the heart. These kind of groups we use genetics is application and seek for patients, do you have the genes for high fat in the blood vessels? And then we proceed with screening and continue monitoring. Sometimes we have close monitoring because photon counting will play a role in assistance, because in monitoring a patient, we do not want to overexposure of radiation. We want to have clear imaging. This is an example, but if I give examples, I can speak the whole day. I could genetic disease, issue with the brain, with the bones, right? Or even Professor Schultz mentioned that some patients have family disease, that many of the members of the long history of family that have lung cancer, right? So we want to bring these patients to screen and try to seek the culprit as soon as possible. I personally think that this technology is extremely beneficial. Thank you very much, Professor. You see the bigger picture, preventive medicine, not only about diagnosis and treatment. Now, an important question, Professor. Why do we need to choose CT photon counting at Bumrungrad International? Can you tell us why? You want me to answer it? Well, I was afraid to take the mic, to take the limelight from the other speakers here. But when it comes to acid genetics, I want to say with DNA. Because Bumrungrad, we have a DNA in the organization, the best in the world. What is Bumrungrad's DNA? You heard Barry mention about it. You see Barry's quote. There are 3 words that I learned from him. Frontier. Second word from Barry, I heard continuous. And third word is innovation. We are always number one. Not only number one, but because Bumrungrad always the first and continue to be the first as leaders when it comes to excellence. And finally, we remember about the frontier, right? To be number one, to be continuously, you must have innovation. Photon counting is one of the important innovations that will be part of our portfolio, because Bumrungrad has a fantastic DNA already. No matter how good the instrument are in the hands that people do not know how to use it, or in an organization that do not know how to use it with its full benefit. So if you ask me, and I'm going to answer you back simply, you need to use the services of Bumrungrad International, because we have the best medical personnel, not only doctors, but we have, you can see, feel it. We have the best medical teams, medical personnel, medical teams. We have the technologists. We got the nurses, or even the executives, led by Barry and Rat and Piring and Professor Tui Sin too. I have full confidence that everyone in this room will have full confidence to say, use the services of Bumrungrad because our DNA. And finally, I think that people often mention, what is Bumrungrad? For me, Bumrungrad is not who I am, but how many I am. Because there's so many aspects, not only the best hospital facilities, but we can actually have everything in our portfolio and the services to both the patients or anyone that uses the services at Bumrungrad International. We don't say that everyone should be a patient, but we believe that the general population with better healthcare can use our services at our hospital. Thank you so much. Yes, the answer is extremely inspirational. As you can see, that because Bumrungrad has a corporate DNA, both our physicians, our specialists, our executives with vision. This is the reason why we apply technology and innovation that will improve the healthcare of the Thai population and the global population for futures and years ahead. Thank you very much, Professor, for sharing your insights. I think both who are viewing online and here in the press room, you probably have questions in mind when I ask our specialists. Now we're going to open the floor to ask any questions, any inquiries with our medical specialists. We are here on stage, 5 specialists. So any questions, please ask. Please begin asking your question.
โอเคค่ะคำถามมาแล้วนะ
The question is in my hand, professors. First question, assigned to you, Professor Witt, CT photon counting, this technology, what are the limitations? and what group of patients that are to be cautious when using this technology? Well, photon counting. There is no limitations compared to conventional CT. On the contrary, the limitation will be lessened because on average, the limitations when it comes to CT scannings are there are three main issues, limitations. Is that one is radiation level, two is about chemical radiation, and thirdly is that the patient has to lay still. But photon counting will decrease all these gaps and all these barriers and shall lessen radiation, chemicals use lessen too, and prompt quick scanning. Believe it or not, CT photon counting, if you lay on the bed, it only takes 1 to 2 seconds. 1 to 2 seconds. In a heartbeat, done. It's that fast. So this is the reason why it decreases the limitations when it comes to patient screening. 1 to 2 seconds is like a heartbeat, like holding your breath. No issue to concern, or patients with claustrophobia. Second question. How about the Thai population these days? We are about to advance into an elderly population. So we're curious. CT photon counting, how it can screen disease for the elderly. Can you give one example? When it comes to screening patients, screening before any symptoms. You don't have to wait symptoms to occur, then come for a check, especially for the elderly. Photon counting can assist. There are two major things, benefits. One is the screening for dots or that potential tumors that may metastasize into a cancer, preliminary cancer, right? We look at plaquing or calcium buildup at the heart vessels too. Photon counting, we have a program, a software that can screen dots in the lungs or plaque buildup at the heart from one scan. So the patients, they can lay on the bed, scan in a second, and they can actually have a diagnosis immediately. So in the past, you used to separate one scan and then you get radiated twice, right, Professor? Now at Bumrungrad International, you can scan once, get radiated once, and you know about diagnosis immediately, both the potential heart disease and calcium buildup, right? So especially the elderly that do not want to be radiated or the vulnerable population can actually use the services, right? Yes, decrease radiation and save time. Next. Oh yes, we're still on screening here, so I want to pass to Professor Polakrit. This technology, CT photon counting, can it screen the potential genetic risk or not? I think that when it comes to genetics and photon counting, it's kind of hard to find a relationship. But this technology should be beneficial when in screening every disease that you can use, that the technology is applicable. But if you ask as a geneticist, you must accept the fact that with the high technology when it comes to genetic screening, we can actually pinpoint the risk from genetics, which we can also lead to other risks due to genetics. When we have the identification of abnormalities in genetics or some type of mutations, there are some abnormalities that can actually metastasize to other organs. Like for instance, lipid buildup in the blood vessels. They actually lead for some genes besides abnormalities in the blood vessels. Sometimes some organs may have abnormalities as well too. These kind of patients, when they talk to the geneticists, we work with the pulmonary specialists or the neurologists. Sometimes when you have to, we say subject, they will be subject to the X-ray, CT, MRI, often many rounds. Sometimes have to do it from head to toe. Which higher doses of radiation followed by surveillance and monitoring every 6 months, every year. Radiation is something of concern, but from my direct experience from photon counting, one quick to decrease radiation. And these patients, despite the fact that we have to continue monitoring for their entire life, if I ask me personally, it would be beneficially. And finally, there may be some issues with genetics. Some of the diseases can increase severity. This is why we need this kind of technology with high resolution to detect these diseases early on. If to make it tangible, disease such as Maffick syndrome it's kind of hard to listen, right? But connected tissues issues, for instance, these groups of diseases may actually have an impact to different organs, especially the blood vessels. You know well. Thank you very much, Professor. Well, you heard about genetics in detail. Another additional question is that, may I ask Professor Berkshire? It's an interesting question. CT photon counting can actually screen the brain imaging, right? So we want to ask about this technology. How can it help the clinician distinguish more complex disease like Alzheimer's or Parkinson's, for instance? I think there are actually two questions, one question that you asked. First, I think that CT photon counting is beneficial, extremely beneficial from use, especially in blood vessels, the highest, especially in blood vessels, because this technology can enable us to see the evolution of the blood vessels. But sometimes some diseases that are abnormalities in the chemicals, for instance, Alzheimer's, Parkinson's, for instance, I think that the disease itself is the abnormalities in the chemical content. We're not there that stage yet, but deep inside me, what I feel, because the data is not available, but soon in the near future, we'll have some markers, because this is the marker that may assist for our diagnosis. Because I believe, true confident with Siemens will develop this marker, but as of now, I think what is important for my takeaway is CT photon is actually beneficial for blood vessel screening. So I'll leave that with Mr. Chris when it comes to new innovation from Siemens. A lot of questions coming in. I am trying to read all the questions here. Next question. I'm going to ask Dr. Show, if you use CT photon scanning for heavy smokers, how is it different from the conventional CT? Yes, well, let's segregate this easily. When it comes to indicators of scanning, it's the same. Like if you're a heavy smoker for a certain years, right? This is one of the symptoms, indicators that you need to screen. Or you have genetic issues, family history of the disease. But the question, the difference is that the resolution or the map that we obtain, because when the images with higher resolution, a better mapping system. This is why decision making of the physician in deciding for what proper treatment or what proper diagnosis do we need to extract or do we need to just monitor. Well, I do believe as a doctor, it will actually increase precision for treatment. Let me ask it simply because I hear you got many questions, right? Okay. Next question. I'm going to ask Professor Witt. Professor, you mentioned about cancer at the start about this discussion. The question is, CT photon counting, how does it can it screen cancer? And can this technology find the abnormalities in other internal organs, such as the pancreas or the liver? When it comes to cancer screening that we leverage from photon counting, is especially potential cancer in the lungs. It's easy and you don't need to use markers. But if you need for other, like mammalian cancer, breast cancer for instance, we'll have other tools that have higher efficiency when it comes to screening. For instance, breast cancer, I recommend to use mammogram. If you want to look at the intestines, we use otoscopy, for instance. We'll put a camera in the gut. So we have a screening in some specific disease that is appropriate for CT screening. Professor Vanessa, for patients with heart diseases that uses CT photon counting, what are the things that need to be aware of, to be cautious of? Caution, it not be different from the conventional CT because CT photon counting is a non-invasive test. Because you don't have to do surgery, there is no risk that different from the past. But furthermore, it decreases risk because we use lesser markers and the lesser radiation exposure. We consider it a safe test and actually detailed data, more precise as well too. Thank you very much, Professor. Professor Pulakrit, there is a question stated to you. When it comes to radiology, what is the future direction and how can you actually plan for preventive treatment? May I answer it this way due to the fact that I'm not a radiologist, but let's talk holistically here. I, as someone to follow with technology and work with all the professors and medical specialists, in the near future, all these technologies will not be limited when it comes to radiology, but other technologies such as artificial intelligence, AI, will play a role in assisting doctors in diagnosis. Professor Witt, you can actually add on to this, emulate on that, like photon counting application. You must use AI, all these algorithms that will assist in the physician's practice. It's like a co-pilot, right? AI is not going to replace physicians, but they're going to assist physicians. This will revolutionize healthcare faster, safer, quicker, and to be on alignment with healthcare in the present, especially the elderly population. We talk about longevity as well too, a longer life. Now, come to the question in my hand. It's like pulling out a lottery ticket here, but you probably answered it. CT photon counting is only at Bumrungrad. Yes, yes, everyone unanimously answered yes. Only Bumrungrad has it. Now, from the actual practice and actual application, the audience will ask, have you found any limitations or any limitations that you uncovered? The limitations will be not different from the conventional CTs, but the decrease of limitations, in fact, as all the professors have mentioned, less radiation, higher resolution, quicker scans. It actually decreases screening to the patients, so the patients can have more opportunity to increase more CT screening. So it seems to be no limitations, actually decreases the limitations of conventional CTs. Let me tell you, actually increases opportunities for CT screening. On alignment with the question, there is a question due to the fact that it's a new instrument, new technology. Do you think this technology should be used on what specific type of patients? Or can this technology be applied on screen to all patients? Yes, in all patient groups. The major focus that will benefit from CT photon are patients that will want to screen blood vessels, especially in the plaques that may occur in the heart, or even potential of stroke or blood vessels in the brain, for instance. And in Bumrungrad, we use for the screening of potential pulmonary cancer patients. So, in summary, you can prioritize or specify patients that have the highest benefit from photon counting for screening, right? Yes, that's correct, ma'am. This is an advanced question for you. But I want to see the compare and contrast from PET CT and spectral CT. Allow me to answer that. This is a really advanced question, really technical. The PET CT first, all right? PET CT is this. It's screening through two types of technology, one PET and one is CT. You combine it together, we call it PET CT. Which CT in PET is similar to the ones that we use today? And PET specifically is about screening of the abnormalities in the body by injecting isotopes, which is high radiation, these chemicals of high radiation, to find the abnormalities, such as potential cancers. This is why it's called, we call it medical radiation. No, medical radiology. And all these isotopes will cling on, attach themselves to the one that one screen. If you want to specify specific in cancer, you use actually what? Cancer uses sugar, for instance, to grow, right? So we inject these isotopes that have characteristics of sugar, and this sugar will attach itself to cancer cells, and it will radiate in the imaging. But besides PET CT, the images, there is no analysis, so you need to use CT scan to fuse with it as a fusion, so that as physicians, we can see what abnormalities where it's located. That is PET CT in a nutshell. PET CT look at physiology and how it works, but CT scan will focus in physiology. But spectral CT is analysis of energy of the tissue in the body. I have told you, photon counting CT. The machine can actually count the photons that arrives to the machine. Then we can actually inspect the energy level because different tissue uses different energy, and we'll plot it at a spectrum on the graph from least to most. And we use these energy levels in giving additional information for the radiologist in further diagnosis of what type of abnormalities they see. So CT, if they have a kidney stone, for instance, okay, let's get for patients with kidney stone. If you use spectral CT, we can identify that this kidney stone consists what? Acid stone, uric, or osseous stone will have an impact on treatment. So that would come urologist, for instance, we have to invasive surgery, right? Okay, this is not only CT, nuclear medicine as well too. Thank you very much. The final question, when it comes to the cost in comparison to conventional CT, how much? Oh, Professor Fry, I think that you're the best person to answer this question. I have to inform the audience that Bumrungrad, we have guidelines for accessibility for the general population, every citizen. So any kind of price increments will not occur, but what will occur is that CT at present, how much does it cost? And the population with high risk that will require the services of that, we will keep our price constant. Let's close that with a final question that way. Well, I would like to end the panel discussion questions. And our press and media, if you have a question in mind, the floor will be open to you at the backdrop. Thank you very much to our specialist. I would like to hand the stage to Tasna Wood. Well, Professor Benjamin, I think you can actually carry the event to the end. Well, everyone, please round of applause to the moderator and our panelists. And I'd like to thank all our specialists once again, Reed Workshai, Jam Show, and Polakrit. I do believe that all of you probably heard about the guidelines and the benefits of photon counting CT. And next on the agenda, I would like to, panelists, please stay on stage for a group photo. I can say that Bumrungrad, we have a determination and commitment when it comes to treatment to increase the better livelihood. And many specialists and our medical personnel, like the professor had mentioned. When it comes to photon counting CT, besides enabling physicians to uncover early stages of disease and support and assist for precision treatment with speed, there are higher resolution of imaging which will have proper treatment and plans. Furthermore, it's an innovation that actually decreases radiation exposure, which is advancement in medicine, which actually pushes the envelope when it comes to healthcare standards with efficiency and safety. It's about auspicious time on the agenda to please invite our executives and our specialists to have this photo session.
To take a commemorative photo together on stage. Would you please? Mr. Barry Wolfman, Senior Executive Director of Operations. Dr. Athirat Charukit Pipat, ประธานเจ้าหน้าที่บริหาร
Dr. Tambayun, Chief of Medical Treatment.
Managing Director of Siemens Healthineers Thailand และนายแพทย์อลงกรณ์
MD Gurugrat, Radiologist, Head of Radiology. Please come on stage. On this occasion, I'd like to invite the executives of Bumrungrad and Siemens to come on stage for a photo session. This is the official closing of the press conference. On the theme, Unlock the Future of Screening and Diagnostics with Photon Counting CT Technology. On behalf of Bumrungrad International, I would like to thank all honorable guests to spare your precious time in attending today's press conference. And of course, those that are watching live through our Bumrungrad Facebook. I hope that this session will be informative. And for press and media, if you have additional inquiries, we have the press release area at the foyer at the backdrop. I am Bumrungrad would like to close and end my duties as the moderator. Until next time.
My role as the host for today. Thank you all for being part of this special event. I look forward to seeing you again in the near future. ขอบคุณและสวัสดีครับ
Not connected. Please shut down the device. Not connected. Please shut down the device. Not connected. Please shut down the device.